The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to the webinar. This is Heidi Hoffman, Senior Director of Technology Communities Marketing here at SEMI. I'll be your moderator. While everyone's getting settled, I'd like to take a quick look at some of our upcoming activities, specifically SEMICON West, which is our largest activity of the year in North America. And I think, and it's the location of events and the sharing of a lot of information that'll be of interest to you if you're interested in sensors and medical industry trends. The overall theme is Beyond Smart. It will be showcasing technology trends and on semiconductors and health electronics and how it all fits into the electronics manufacturing ecosystem, members of which SEMI represents. Let me start with one specific program on smart medtech. Our tech spot in the North Hall will be focusing on digital medicine and remote patient monitoring. SEMI's Nano Biomanufacturing Consortium has done some groundbreaking work over the past couple of years, and based partially on that, we'll be discussing what's next and how today's tech will be playing into the solutions, rolling out to all of us as healthcare consumers and, of course, technology providers as well. A really exciting co-location this year for the first time will be the Wearable Technologies Conference. The last few years, this event has been on the other side of San Francisco, but this year it'll be in a special space in the North Hall and included in your SEMICON registration for a small upgrade fee. There's a fabulous list of speakers. Check out the website, but the speakers include GoPro, NASA, HP, Emotiv, Cioserve, Shell, Balancel, the NFL, Omron Healthcare, and quite a few more. I could go on. But check it out at wearables-technologies-us.com. Going back to the sensor side, we have a great tech spot on MEMS and sensors, where some of our industry experts will be looking at key applications for sensors, including IoT and autonomous driving. It's a great place to know everybody's going to be there from the MEMS community. There's over 70 exhibitors showing MEMS products on the exhibition floor, so you'll want to wander the floor as well. If you're an MSIG member, I hope you have already registered for the member-only reception at the Red Dog on July 11th. If not, certainly drop us a note and let us know. If that's not enough, we have extensive sessions on smart manufacturing and smart transportation, as well as over 70 standards committee and task force meetings that happen at the same time as the show. So check out the website, semiconwest.org, to see the full agenda. Click around a lot because there's a lot of information there. It sounds like a commercial, but truly, no one treats the electronic supply chain business and technology as thoroughly as SEMI and SEMICON. So we hope to see you there. Switching gears quickly to a popular topic with SEMI FlexTech right now, our 2018 open solicitation hit the streets last week. We're looking for proposals for the listed topics, obviously focused on flexible hybrid electronics. We encourage putting together multidisciplinary teams in order to bring really comprehensive proposals to the table. Our reviewers really like that. As many of you know, we use a white paper process as a down select and a method to give proposers preliminary feedback before the final proposal stage, saving you time and effort and making for better proposals. These are due July 9th, and full proposals are due August 20th. So we anticipate multiple awards on this one, and more information can be found at flextech.org. We will have staff at the SEMICON West show if you'd like to talk to somebody in person at the SEMI Lounge, which is at the bottom of the escalators in the South Hall. Please come on by. We'll be there ready to answer your questions, say hello, and help you with any information you might need. So on to today's topic. We are pleased to have Lawrence Gassman back. I think it's been a couple of years since we had a webinar from Lawrence. And he's going to cover the topic on healthcare sensors and market developments and some of the business cases that companies are using to bring products to the market. All of FlexTech members know that NTech provides research reports that FlexTech puts on our member-only site, the Connect@SEMI website, and that you can download. I think we're receiving 6 of those this year, so I hope you'll all take advantage of that on the Connect@SEMI platform. So our presenter today, Lawrence, is a principal analyst at NTech Research. He's a consultant, speaker, and author on new technologies and manufacturing technology markets. There's a lot of consulting on new product introductions and market positioning, even some due diligence on mergers and acquisitions. He was educated in the UK, Manchester University, London School of Economics, and London Business School, which explains the delightful accent. But before I turn it over to Lawrence, let me make a few little logistic comments here. Please put your questions in the Q&A box or the questions box on the control panel at any time. You're all on mute. We're recording the session, and you'll receive a link to give to other folks in your organization that might be interested in listening in or re-listening yourself. And want to mention that previous webinars have been recorded, and they're available at semi.org for our members only. And we're always looking for great ideas for new webinars. So if you're a member, please send me your suggestion or proposal, and we will chat about how we do this activity. So with that, Lawrence, I believe the floor is yours.
Okay, and I just press show my screen, and lo and behold, I see my screen. On the question of my accent, I've lived here for 40 years and for some reason never lost my accent, despite the fact that my wife and kids, most people I speak to every day were born in this country, and I don't suppose I'm going to lose my accent anytime soon, so you'll have to bear with me with the British accent for the next 30-something minutes or so. So today I'm talking about flexible sensors and flexible electronics in healthcare applications, and I'm going to focus on the business case, business cases, I suppose, because I think that by doing that, you get a unique perspective on where the money-making opportunities are in this business, which isn't something that's really been focused on too much, and I'm going to explain that remark a little bit throughout the talk. Just a little bit about NTech. Heidi was kind enough to talk a little bit about it. NTech used to be Nanomarkets. We began the business about 15 years ago when nanotechnology, nanomaterials was all the rage, and began it back then looking at things like nanosensors and nanomemories and things that were very hot in those days. And gradually we transitioned out to look at other areas. And the way we think of ourselves now, one of the reasons we changed our name to NTech, is looking at new developments in electronics and energy markets that are enabled by advanced materials. Many of those materials are actually nanomaterials, but we're broader than that now. And that is very much what we'll be talking about today. We do, Heidi's already said this, we do market assessment, company analysis, technology analysis, due diligence. I think we're probably known in particular for our reports on smart windows and building integrated PV. We're sort of getting back into the display materials business. We haven't done so much on that recently, and we're looking at sensors very much, what we'll be talking about today. And if you have any further interest in what we do, then I suggest you go to our webpage, which perhaps not surprisingly is www.ntechresearch.com, and there's a telephone number there if you want to talk to a live human being about what we offer. So I didn't choose this topic. We provide some reports for FlexTech members, as Heidi mentioned, and one of them, one that's just about to come out now, is on flexible electronics for medical staff. And so that's the topic that was set for this webinar. And I kind of viewed this with a certain amount of trepidation, because the truth is that there's not that much going on commercially, and I want to examine why that is. So if you look just at flexible printed organic electronics, whatever we call it, this week, we've been following this for about 15 years, and you know, whether it's flexible or printed or organic, it seems a different, I guess, stretchable is now in that. It seems like the cost and form factor advantages that are that seem to flow from that kind of technology are obvious, but in practice they turn out not to be so obvious. The market doesn't agree. There's always new products coming out from this little research program, but they never seem to really go anywhere. There's little fad products and things, but there's no real success story that you can point to in that area. After all this time, with the exception of OLEDs, which are a little bit different even in their history, they're a separate research program. They've got a few big backers. What we've always been told back in the day was this was going to be a major new part of electronics. That's never quite happened. Now look at medical technology, and you know, that's certainly an application for this stuff. But I also want to kind of say that in addition to my role as an analyst, I've kind of formed a number of different industry analyst firms in different technologies. And it always seems whatever the technology is, medical always jumps up. And I think it's just a kind of nice proof of concept idea that, you know, if you're doing something medical, you're doing something good and altruistic and so on and so forth. And so, for instance, I remember when I was involved with the telecom industry that everybody wanted to talk to telemedicine, but really it was a very small part of the new technologies coming out. So you have to ask yourself whether medical technology is a real proof of concept, or it's just a useful it's just a useful mythology that helps drive the interest in whatever technology you're talking about. So faced with all this depressing news, I thought what I was going to do in this talk was essentially say, but don't worry, look at all this wonderful stuff going on in institutes and universities and think tanks and things. Just wait a little while and it'll all take off. And that was the point of Great Expectations. If you know the book, or actually quite a number of movies, the couple actually end up together and happy. Almost everybody else dies, but they end up happy. So my point was, just wait around, and the research that's being done now will eventually result in something good. And that's what I was going to say today, and I'm not sure how convinced I really was that was true. And part of it is true, for sure. I mean, there really are some fascinating things being in the R&D department. And then we did, for a study, we looked at, well, if things just went on as they're on today, and there were no, you know, big boom technologies, what would the world look like? And we really couldn't come up with anything all that optimistic. These are our numbers. You get to about 50, 60 million in 10 years, 9 years, whatever that is. And a big chunk of that is sensors, which aren't necessarily for medical alone. You know, that's the kind of business where a big company would put a couple of people working on this. So again, nothing too exciting. But then I had a kind of epiphany. and I'm going to talk about a little bit about my epiphany. And while Gasman's Gizmo, the slide we're looking at now, this actually happened last week, and when I started thinking about it, it happened to me last week. When I started thinking about it, it seemed like it told me some important things about where we could be headed with all of this in terms of making business cases. So let me spend a little time on this and backtrack a little bit. I'm a 68-year-old diabetic, which I know you all wanted to know, but I'm working pretty hard now trying to keep my my blood sugars low. And my doctor last week recommended I got a new type of blood sugar monitor. I think probably a lot of you know what the current blood sugar meters do. There's a little test strip, and you push it in, and it reads out a number. The test strip, by the way, is actually printed electronics, because it's usually flexigraphically printed on a flexible substrate, although the substrate wouldn't really have to be flexible in terms of its functionality in the meter. It doesn't matter very much. This thing is basically a sensor that goes on my arm, and in the bottom right-hand corner, you'll see my arm with the sensor on it. And at the top, there's a meter that looks much like my ordinary meter, but it's much thicker. And again, I'm truncating this, but it's a wonderful innovation for people like me. I can tell what my average blood sugar is. I can instantly tell what the impact of taking a particular meal is. And actually, I've only had this thing for about 10 days, and I've noticed real effects on my blood sugar, which is important. I mean, it's my life. But, and it's a big but, I think this thing is wonderful, but there's some real issues about this that I think could be solved with flexible electronics. And we'll go into which other products could benefit in a similar way in a minute. Let's talk about the little calculator monitor device. It's really quite thick. My regular monitor is very thin, fits into my top pocket. And this is thick and rigid, also fits into my top pocket, but you're aware it's there all the time. It needs to be recharged fairly regularly. It's not, honestly, it doesn't need to be recharged as much as my Apple Watch, but it does some work on I mean, it's got a Bluetooth connection, and that takes up some power. So that's something that my regular monitor doesn't have, and it's expensive. This whole setup is about $110, $150, and every time I change the sensor on my arm, it is $40, I think. And I'm fortunate enough for that not to be a big issue, but clearly 10 days from every time you change the sensor. So it's, by the time you're done, it's about $130, $140 a month. The sensor's stunningly ugly, which would put some people off, I think. It's expensive, I already mentioned that. It doesn't go through airport scanners. Then you have to take it off or something. I haven't actually had to deal with that yet, but I will. And what I thought was, oh, wow, this is something where flexible electronics actually has some real use. Imagine that you use that, the constituents of that research program to make everything less expensive, perhaps doesn't have to be recharged as often, thinner, as far as the sensor goes, maybe less obtrusive. That does look ugly on my arm, I think. And I have no idea what's involved in going through airport scanners, so I really don't know if flexible electronics would help there. So the point I'm trying to make is, here is one particular product that exists, that's real, and if somebody were to come up with some innovation based on flexible electronics that would enable that to go down in price and up in functionality, I think they'd have a winner on their hands. In a minute, we're going to review how many diabetics there are, and you'll see sort of what I think the numbers are in terms of revenue generation, just back of the envelope stuff. But now, that's just one example, but I think you also have to have a framework to understand where you should be looking with regard to where the opportunities are. And I think what you do is you use this sort of megatrend analysis that John Naisbitt put together in the 80s. And if you see my little small font at the bottom, he was actually wrong about lots of things, but it's a place to start. So if you're looking for medical products that are going to succeed, and in particular, flexible electronic medical products, I suggest you look at three things. One is generational change. The other one is focus on outcome and value and not on pay for service. And the other one is personal medicine, another giant megatrend. I guess all megatrends are giant. What I'm thinking about is, and everyone knows this, but it doesn't make it any less important, that in the developed countries, population is aging significantly. The boomers, my generation, are also concerned, not entirely, but more with health than certainly my parents' generation were. And that's good if you're trying to sell medical stuff. And I mean, people, the first one means there's more of a addressable market. The second one, boomers concerned with health, means that, you know, actually there's an effective demand. And then moving beyond that, you know, millennials, who actually apparently, it's an article I saw yesterday, aren't that concerned with their health. At the very least, are actually very comfortable with embedded technology, such as flexible electronics tends to produce. The second outcome, second megatrend is really about outcome and value instead of pay for service. And I'm really talking about the US here, which I know the best, that the model there in terms of insurance companies paying was always, well, I got this service, therefore the insurance will reimburse for this service. There's now a trend towards looking at the outcome and paying for complete packages, bundled care it's called, or total packaging. And I think that flexible devices, especially monitoring devices and other things, address a lot of issues, not particular services, and so fit very well with outcome and value. And then there's personal medicine. This is a long time megatrend in medicine and in healthcare. And originally the idea was to bring care closer to the patient, which had some obvious advantages. But now we've moved to the next stage where we do medical wearables, medical IoT with ubiquitous monitoring, which is sort of what I was showing on my blood sugar meter, and then the possibility for personalized drug delivery. Now, all of these things have existed for quite a while, but the potential is there to bring down the cost and make these devices more miniaturized and make the whole thing less of a research project, less of a science project, and more of a real product instead of a project. So back to diabetes. There are 371 million people worldwide who have diabetes. About 1/10 of those are people with type 1 diabetes who need to constantly control their blood sugar because they don't actually make insulin at all. The rest are type 2 diabetics like me, who still need to control their blood sugar, but do have some insulin functionality. I guess I can get away with saying things that sound kind of cruel because I am a diabetic. I mean, the good news is that's a huge number. And some of these people don't even know they have the disease until much later in life, but they do find out. And that's a huge number. So the numbers that come after that are just my back of the envelope numbers, really. That there's probably a $2 billion potential market for flexible diabetes and a few $100 million. But yeah, what we see is that if you could get something like the meter that I showed you, you could see how something that performed at that level could really take over from where traditional blood sugar meters are now. And again, I haven't really counted in any of my numbers diabetic test strips because I don't really think they're flexible electronics in an interesting sense. It certainly addresses devices of this kind certainly address generational change because diabetes is definitely a disease of aging population. It definitely addresses our focus on outcome and value, not pay for service, because you're trying to control, what's a key part of your healthcare. It's not just one service. I mean, it's not just that the numbers of megagrams of sugar in your blood. It's something bigger than that, and it's most definitely personal medicine because you carry this thing around with you, and we've come a long way. The meter I use regularly before I got this one replaced basically having to take urine samples and then test those, which, I've never done it, but I can't imagine it was very fun. I don't want to talk too much about diabetes because, obviously I've got a personal interest in it, but also, by the way, diabetes, I think, is I don't say a sweet spot, maybe that's a bad pun, for this kind of product. And that's because each diabetic should have regular monitoring of his blood sugar. So everybody really needs a monitor, although it certainly isn't happening yet. And second, there's just so many diabetics. When you go to the other areas, you start to see smaller numbers. So the other thing I think you could get, for some reason this keeps on disappearing, I'm not sure why, is monitors that are essentially electrocardiograms. And you can have different kinds of electrocardiograms. One of them would be a little bit like a blood sugar monitor, that people who have had heart attacks or have a serious coronary disease could actually just wear one of these things and could be warned of impending heart attacks, or even they've already had a heart attack or something like that. So suddenly you get, and thanks to miniaturization and flexibility and all these other things, the potential for electrocardiograms that you can carry around with you, or that can be used by emergency staff much more readily than what they have now. You can presumably lower the price of these things. A lot depends on what performance you can get out of them. There is, as I said at the bottom of the slide, there's some R&D work going on in this area, and it's certainly an area that interests people in flexible medical devices, as does EEGs, by the way. Haven't really talked about that. But when you consider that, at least in America, heart attacks are the most, or the the leading cause of death are actually men and women, you can see that there's real demand. And that's the point I'm trying to make. I think that as we move forward with medical flexible electronics, you have to tie them in with real demand. So that's the numbers, and that's also the megatrends that I pointed out. I think, again, when you begin to crunch the numbers, you sort of look at maybe 1 to 2 million units per year. Depends a lot on how far you can miniaturize these. You know, I don't think people would carry them around just because they thought they might get a heart attack. But obviously, there's a lot of people out there who've had a heart attack and just want to be a little bit more sure that, you know, they aren't going to have a cardiac event, or they can see when they are having one. It's probably closer to it. Again, ties in nicely with the megatrend analysis that I suggested. Generational change, obviously heart attacks are associated with aging populations. Even if you look after yourself at a certain stage in your life, people just have heart attacks, and having a warning is always a good thing. Personal medicine, we talked about that. Certainly, another thing that flexible electronics seems to suggest is that there'd be more comfort for patients. I mean, really back to carrying my monitor around in my shirt pocket. In fact, there are some systems where I'm trying to remember who did this, but there's an R&D product that is basically a T-shirt that you carry around and that can monitor your heart rhythms and that kind of thing. I don't think that's a real product yet, but you know, for a certain part of the population, that may be very attractive at the right place. Flex-Tek's obviously involved in this, but also a number of R&D groups, you know, powerful R&D groups. I mean, when the Hulse Center, IMEC, and Flex-Tek speak, people listen. And I believe, I can't remember if this was actually at the Flex-Tek event or somewhere else, but GE is involved in it. So this is a real-world product. I don't think they're out there in the way that my diabetes monitor is, but we're talking about real numbers from real companies. You know, sometimes things take off and sometimes they don't, but this is a real revenue potential. The third thing I wanted to talk about was medical patches. This is a little broader area. There is obviously a medical patch industry, and it's really quite large. I don't actually know how large, but I've heard different things from different sources, and we're talking about a few $1 billion. So this includes patches to take you off cigarettes and other things, cosmetic patches, and none of those have anything to do with electronics, as far as I'm aware. But what they do have to do with is I'm sorry, I lost my train of thought for a minute. What they do have to do with is that there's already a fairly well-established patch industry. So if you work towards electronic patches of some kind, what you'll find is that there's a manufacturing infrastructure that can support building those. Again, we're looking at a fairly large number of companies, serious companies that are working in this area, which is also good news because large companies can make things happen. Although there's plenty of room for smaller companies in these areas too. Um, so there are two areas where I think that that we can see some real potential for using flexible electronics. And I must say that when I started crunching numbers on this, I couldn't see, it was hard to come up with something that really convinced me. So it's possible that that these numbers may not be as big as the other ones, and it may actually be that these numbers are further off than the other two. And that's one of the points I'm trying to make in general now, is that there's really fairly limited a number of areas where flexible electronics has a short-term revenue potential. One of these is where there's a clear substitute of medical patches for implants. It's been traditional since the 1950s to put things in people's bodies to release drugs, to monitor, and I think to some extent that's always going to be true. For people who are seriously ill, they're going to go for the highest performing monitors and control functions from, and they're always going to be implants, I think. Well, maybe not always, but certainly in the near term, they're going to be that. But there are some patches that could provide stimulation, is another one, and monitoring and everything else, and much lower cost than an implant, both operational cost and capital cost, because putting an implant in the body is costs money. Much fewer risks, and that's because an implant is obviously internal, and also less regulation for essentially the same reason. So there's a whole slew of things there, I think, for electrically driven, flexible electronics in medical patches. Now, I have to say, there have been plenty of attempts to do stuff like this, and this is one of the reasons that I haven't put any numbers on this particular opportunity. And, most of those are in the graveyard of corporate history. I'm thinking that a place to start is actually drug delivery of some kind. This fits nicely with some of our megatrends, especially personal medicine, but it may be more effective to use a patch than even a time control pill, may be safer. And there are numerous maladies where drug delivery of that kind would be a very attractive opportunity. People, there can be a patch. People talk about smart bandages, which are very similar, not from a design point of view, but from a functional point of view. So there seems to be a lot of opportunities out there. I think what would be really interesting is if someone did some analysis of which particular drugs and which could be used in that way and which particular implants. Now we're sort of coming towards the end of this, and I want to leave plenty of time for questions. I think one thing, I don't have a slide for this actually, but I think it's kind of important, is how people get into this business. One way is obviously to do lots and lots of R&D, and that's been happening for a long time. But I think maybe, and the second one, which has really been the thrust of my talk, is to look for the areas where there's real and immediate need. And, I refer back to the device that I started using last week. But I also think there's sort of lesser areas that serve as entry areas for flexible electronics that are worth a look at. At the very least, those areas don't require as much regulation, and in a sense, they have fewer risks, and it's a place to start. One of those is sports medicine and sports monitoring. Often the wearables and the sensors and all these things are very similar to medical patches in this particular case, but medical electronics. And it's, as I said, it's a place to start. If you can make that work, if you can generate some revenue, then maybe the next stage is more serious, products for people who are really sick. But again, place to start. The second one that I thought of that's worth pursuing, I don't quite know how you pursue this, but and I'll tell you why I think it's important in a moment, is actually veterinary medicine. And the reason obviously is the same things, risks and regulation. We don't put the same set of concerns on animals as we do on humans. It's totally obvious. The reason why I thought of this was actually some work that another one of my companies had done on 3D printing for veterinary areas. And we're just talking to some experts in that field. They said, oh, sure, there's huge potential there because you just don't get involved with the regulation. And then they said, well, you think about it for your pets and everything, and, some people would use something that advanced. But for farm animals, especially prize farm animals, vet owners spend a lot of money on veterinary science. And if you can give them something that will help cure an animal of a disease, and it's some kind of electrostimulator or some kind of drug delivery system, that has a lot of value too. Now, we haven't really looked closely into the market for flexible electronics in veterinary science, but I do think that's another opportunity. So I guess we're getting a little bit towards the end. This is me, and Heidi was kind enough to say a lot of nice things about me, so I'm certainly not going to read that to you. And then our final slide is how you contact us. And do contact us. We'd like to hear from people who are doing interesting things. We like it even more when we can sell you a report or a consulting study, but this is partly relating back what interesting things that people have told us. And that's sort of it. I'm very open to a lot of questions. Thank you.
Lawrence, thank you so much. Very interesting. Key points there on the veterinary medicine. Really haven't heard much about that, talked about that at all in the things that we're looking at. Yep. So very interesting. Okay, so as Lawrence said, please put your questions. We have a couple into the questions box, and we'll get to them time permitting. Let's see. Actually, Lawrence, if you could put that slide back up, that'd be great. People can write down contact information. Yeah. All right.
Actually, I think that the real innovation is not flexible electronics at all. It's that somebody comes up with a decent webinar software package. I've been doing this a long time, and they're all bad. So anyway, sorry.
Okay, well, while you're thinking of your questions, I just want to mention we have a couple of upcoming webinars. You can see them and register, get the links to register for them at SEMI.org on the events calendar. One is SEMI and Yole are next week reviewing the latest trends in automotive electronics. That's June 27th. And then on the following day, our electronics materials group, EMG technology community, is doing one on Santa smartphone and how that smart manufacturing is impacting technology developments. So again, that's on the SEMI.org website to register and to learn more about those. All right. Okay, so let's get started on the questions. The first one, Lawrence, is what are the opportunities for small companies in this business and when will they appear?
So there are some small companies around. If you look at the whole flexible electronics business, it seems like they flourish for a few years and they're kind of cool and then they disappear. Some of them have used up a lot of money on the way to way to disaster, I suppose. In the medical electronics field, there's always the problem of regulation, and that's obviously that adds cost, but not just in terms of what it actually costs to get things tested, but the time frame. At least in the U.S., people get a few products out and then they test them and then they can sit there for quite a long time before they get approved. And that was one of the reasons why I think there's some sweet spots in veterinary medicine and in sports medicine where you can stay away from that. And I mean, if you're a big company, that's just twist of the mill. You know how to deal with that. If you're a small company, then I think you need to get experts in to help you through that process because it's not easy. I've seen some of that myself in companies we've worked with. But yeah, there is. I think that small companies that focus on maybe some of the opportunities I've spoken before and are very focused actually have some advantages because they have to put together the industrial design, the electronics. They have to be, I hate to use this word, people use it in management consulting circles. They have to be passionate about the product, and that tends to come from small companies and small teams. So I think there's a lot of opportunity there, but they also have to be realistic in building their business models and their financial models around it. I mean, it does seem like a lot of big companies are already into this. I mentioned a few along the way. The device that I'm raving about is actually Abbott Labs, which is, a big company. But it maybe there's an opportunity there for a small company to be a sort of skunk works and develop some product and then, sell the whole thing to a larger company, which is what, these venture funded startups, tend to want to do in all sorts of areas. I suppose I have to say that you have to be a little careful in how you put yourself forward. The example of Elizabeth Holmes and Theranos springs to mind as the wrong way to do all this in the medical field. But yeah, I think there's some real possibilities there.
Yeah, as you say, I'll just add our NBMC consortium certainly found that this mixture of small and large companies together could come up with some things, bringing this multidisciplinary approach to these problems was really key. So I totally agree with you there.
Yeah, and I mean, I was thinking about in terms of, obviously small companies come up with very clever ideas. They sometimes have problems in monetizing them. The comment about Elizabeth Holmes and Theranos was kind of a joke because many companies are quite that bad. But I've seen plenty of companies and plenty of organic electronics in general that have very ambitious ideas and can attract large amounts of money, but they're seldom focused on near-term revenues, and that is not always all that helpful. And what I try to talk about today is at least some way that you could refocus a little bit to the near term.
Thanks. Okay. Second point here, and this is good because we have a lot of international folks on the line this morning. How does what you've presented vary internationally?
Well, a lot. I was talking from a U.S. perspective because, despite my accent, I live in the U.S. and I know roughly how the healthcare sector works. One way it may not vary is that we're talking about devices that are too expensive for some people, but not, not so expensive that, a lot of people can afford them. I have no idea whether my insurance would pay for that monitor. I'm simply paying for it. Obviously, some people couldn't. So what varies enormously is how much insurance companies or insurance providers, I should say, because in many countries that's essentially the government, are willing to support new technology of this kind, and that just varies a lot, especially if they're expected to pay the full boat on some of these devices. I think, and someone can tell me if I'm wrong, certainly in the UK, which I know a little bit about for obvious reasons, it would be much harder to get an insurance provider to pay for these things because they're much more cash-strapped than the US system is. On the other hand, the UK are much more willing than the US to make things available without prescriptions, and some devices need prescriptions. So there is a lot of variance. Probably the other thing that there is also the openness to new technology. And in that light, I'd say, and this is my own personal experience, that the US by far is open to new technologies and gadgets, and just the way we are. So you'd expect some of these devices to appear and be used in the US first. What else can I say about that? There's also R&D funding, which probably FlexTech knows a lot more about than I do, that varies from country to country.
Good. Yeah, that's certainly true. So, okay, next question. How can specifically the semiconductor industry help get these types of products to more of a mainstream market? So focusing on the semiconductor side of this, what do you think the industry could do to improve the product situation?
Well, that's a very good question. On the positive side, I suppose, one thing about the semiconductor industry is if we're talking about the complete supply chain that starts, at one end with the patient and goes all, through healthcare providers to device makers to, the semiconductor industry is quite a long way from the patient. I suppose a few things occur to me. One of them is, vertical integration of some kind. So if you have a chip, maybe the way to get it to market is to, is to come up with the device that it goes into. Maybe you arrange for an acquisition of some company that knows about medical devices so that you can make the market evolve, develop for you much faster. So that's one way. The other way is, specialized chips. The problem with that is almost by definition, they're more expensive than regular old chips. Because what we're talking about here is often, very low cost chips that, maybe they may use different materials and things. A lot of these monitors that are used now have very inexpensive chips that come from, Southeast Asia, and I've even heard of them coming from North Africa. They're not sophisticated. Obviously, there's kind of a dynamic there that eventually some of these monitors things become much more sophisticated. You could imagine, a complete assay being developed as part of some sort of sophisticated monitor in the future. But that is for the future. So I think it depends how focused the semiconductor company that we're talking about here, or the semiconductor industry, is going to be on these things. And then vertical integration is really the obvious thing to do, I think. Specialized chips second.
Good. All right, and now here's one that I'm not sure your level of knowledge of this market, but it's a good, interesting question for me. So the current ECG monitors, some people have shown some products that are flexible. How does that, the type of ECG monitor you're talking about, how is that more flexible or fully flexible, or what are you referring to when you're talking flexible in this?
Right. Well, an ECG, the bit that gets attached to you is if we're talking about, a regular ECG, it's flexible too, because it's a bunch of wires with sensors at the end. So I suppose there is no such thing as a completely non-flexible ECG. What I was trying to hint at was a new class of products that might be a wearable monitor, and that would have to be a different level of flexibility. So I think the flexibility I'm talking about there is not just because wires are always flexible, but something that could be put into a shirt and is conformable with your body and that would be comfortable to wear, which I don't think anything like a traditional ECG or EEG, but that's a different, from a marketing perspective, that's a very different thing, would be. So it's really about comfort there and the ability to turn it into a personal monitor, which doesn't really exist today. And my point really was there's just a lot of people out there who've had heart attacks who want to keep a monitoring brief, and that these could also be easier to take around, for doctors and ambulance people. The other aspect of flexibility and miniaturization, which sometimes goes together, is that the ECG of the future the actual box that does the monitoring might be a lot thinner and more portable. Probably a secondary consideration, but I'm talking about a whole new product class.
Yeah, makes sense. Okay. All right. So very specific, back to your forecast, sensors forecast, the numbers that you put up. What was included in that market forecast on the first slide? What level of integration were you thinking?
Now this was the actual numbers I put out, the little graph with.
Yes.
Well, I think if somebody sends that to me, I can be much more specific, because I don't really remember actually all of them. But what was not included, and I actually said this, was diabetic test strips, because that's actually a huge market. And yeah, it's printable, and yeah, it's flexible, but it distorts the whole opportunity curve, because I think we once looked at it, it's like $1 billion or something extraordinary a year, because you can only use the test strips once. But the market then goes from 50 million to 1 billion and 50 million, of which 99% is one product that doesn't really have any opportunities. We were looking at either, I'm not sure if this answers the question, but without looking at what we actually included, I can't answer it in depth. We were actually looking at kind of devices and subsystems that went into that. In other words, the chips and the flexible PCBs and things like that. That's the other thing we excluded. Flexible PCBs are technically flexible electronics, and they're certainly in some medical devices for sure. But again, it isn't really what we're talking about here. In the market research game, it's always possible to push up numbers by finding something that sort of fits and that's been around a long time. We were talking about leading edge products, the kind of products that people get excited about and keep telling us that they're any day, real soon now, they're going to take off and make lots of money.
Great. Okay. We have maybe like 30 seconds left. So I'm going to ask you this. I think this is a nice one to end on. What is the major hurdle that needs to be overcome for Flex Electronics in the form of patch sensors to become widely adopted in the healthcare industry?
In 30 seconds.
30 seconds.
Well, regulation is always going to be the big one in medical electronics and device electronics, and it isn't particularly true about flexible. I think that actual performance is really important. So you've got this newfangled thing, and it does all these wonderful things that your old diabetic monitor ECG patch didn't do before. And it's really exciting, but you want to know that it's basically churning out the right numbers, and that takes testing and experience and all those things, because you're often in the areas we've been talking about, working with new materials, new kinds of chips and everything, and you know, I've got a fairly flexible doctor who likes to try out new things. But relatively speaking, a lot of doctors aren't going to want to mess with this unless just they're reasonably sure they're giving good advice to their patients in terms of performance.
That's a great answer. So, although I heard two answers, one regulation and two medical significance, but
well, the regulation. Yeah, regulation's always a problem if you're in medical devices. It just is, and it adds cost to things, and it adds time to things. And you really can't go into that business in any country unless you understand what people are going to ask of you, and that's not particularly about flexible electronics, but it is true about medical electronics. And then, you know, we're moving down a new technology path, and that's, you know, if you're doing some kind of flexible electronic game, or an OLED display, I mean, who really cares? I'm talking to you on an iPhone with an OLED display. You know, what could happen that would be disastrous? Now, you know, if my blood sugar on my new machine says it's 90, which is lowish, and actually it's 200, which is disastrous, that's a big deal. But it would be to me or any other patient. So that's a separate issue, and I think the most important in the area we're talking about.
Excellent. Lawrence, thank you so much for your time today. Thanks everyone for logging into this webinar and seeing it through. As I said, more information on semi.org, and thank you everyone. Have a great day.
Thank you guys. Bye-bye.
Bye.